Hey everybody, Dr. Ritchie. One of my favorite charts hanging on the wall in my treatment room. This is the 3 phases of care. And for some of you know this really well. For others, maybe not so much, okay? So that's why I'm making this video, because it's super, super important that you understand what's happening on this chart. So when people first come in to see me, this is where they are, okay? So ultimately, this is it. Typically people are in pain here. We want to get you all the way up to here, which is feeling good, functioning well, out of pain, ideally, right? Now here's the first phase of care. First phase of care is called, they have it listed as recovery. I call it relief. This is getting you to feel better as quickly as you can. Okay, this is weeks to months. It can typically be between 4 to 8 weeks to get somebody feeling significantly better. Now, once you're at this point, the pain may be gone, but is the problem gone? No, because if we had a misalignment or a subluxation of the spine, that is a rehabilitative process that takes time in order to heal. So pain is the last thing to show up, it's the first thing to go away. So at this point, you have a decision to make. Some people say, I'm out of pain, I'm out of here. And they leave, and over time, the problem slowly comes back, and then there's a decision to begin care again. So that means starting back here. So what I'm going to recommend is moving on to the second phase of care, which is what I call correction and rehabilitation. So this is where we're actually rehabilitating the spine, teaching it to stay aligned and to move properly. This is typically 1 to 3 months in order to do this, okay? And once we get up to here, again, there's another decision point. We're through correction rehabilitative process. You're feeling really good. You're functioning really well. Are we going to continue care, or are we going to stop? And if we stop, again, over time, maybe it takes a bit longer, but eventually it goes all the way back down to where it was because we didn't maintain it, and we have to start over again. So what we talk about here is moving into optimization, or what I call wellness care. We can't start at wellness care. You have to start at the beginning, okay? No one starts up at this point. And if you're in pain, you're not in wellness care. So it's really important to have an honest talk with yourself and say, where am I on this chart? And to also recognize when you hit these 2 critical points here, are we going to walk away from all of the time and effort and money that we put into this, or are we going to continue and see it through and make sure we actually get it corrected and keep it that way? Wonderful chart, simplifies it down. Where are you? If you don't know, talk to me about it, okay? And we'll decide, and we'll figure out where you are and decide what's best moving forward for you, okay? See you at the office. Take care.